Metabolic syndrome has become a serious public health concern, increasing your risk for heart disease, stroke, and type 2 diabetes. Roughly 32% of the general population has metabolic syndrome, although many do not know they have it. The risk of getting metabolic syndrome increases with age, with an estimated 40% of people aged 40 to 60 currently having it. With metabolic syndrome, a person does not yet have a disease and can reduce his or her risk factors and move towards health and wellness. Metabolic syndrome is diagnosed when a patient has 3 or more conditions: a waist circumference of greater than 40 inches for men or 35 inches for women, triglycerides over 150, low LDL cholesterol under 40 for men and under 50 for women, high blood pressure over 130/85, and high fasting glucose over 100. Early diagnosis will give patients the best chance to avoid serious complications. However, most of the conditions that make up metabolic syndrome have no signs or symptoms. According to a recent study examining the prevalence of prediabetes and metabolic syndrome in seemingly healthy people, these conditions are even more common than previously thought. This study investigated the prevalence and characteristics of prediabetes and metabolic syndrome in seemingly healthy persons attending a health checkup clinic at a tertiary care hospital. Surprisingly, the prevalence of undiagnosed prediabetes and metabolic syndrome were alarmingly high, with 54.3% having prediabetes and 19.7% with metabolic syndrome. Since both prediabetes and metabolic syndrome increase the risk of diabetes and cardiovascular disease, early detection via health checkup at appropriate time intervals is essential. In addition, prediabetes diagnosed by different glycemic parameters demonstrated different clinical characteristics and laboratory parameters, which may indicate different pathogenesis, and the risk of diabetes and cardiovascular disease may vary. The MD Heart Pro Cardiac Blood Panel has been updated to include key biomarkers to accurately assess patient risk for metabolic syndrome. The new color-coded reports includes recommendations based on well-established guidelines, with an algorithm powered by artificial intelligence that continually improves upon itself, making risk stratification better over time. Put simply, MD Heart Pro is the best diagnostic laboratory test to assess and manage patients with metabolic syndrome.